Yeah, so across the system, we have 17 cases of individuals with COVID-19. 18 of those are admitted to our hospitals, and it's pretty spread out across across the hospitals. But Eastern Maine has 9, like I said.
Okay, that's the most in the system.
Yes.
Okay, gotcha. And I mean, when you and I had talked, I think it was either last week or the week prior. I think you had said that you guys had 2. I mean, or 2 at EMMC. I'd have to go back and
Yeah,
check.
we had gone down to 2 we had just 2 at EMMC at one point. I think that was all, and then and frankly, we'd gone to 0 for a while. But this last week, we started to see those numbers increase, and I'm looking at our percent positivity rate, and it has just been a steady increase since the beginning of July. You can kind of look right at July 4th. We were still down at that very, very low. Looks like we were at 0.4% then, and now we're a positivity rate. Our 2-week positivity rate is 4, and our 1-week positivity rate is just under 5%. So that's, those are the numbers that we were really alarmed about back in November and December of last year. We're right back there again.
I know that a month is not a huge sample size, but what's your analysis of those numbers? I mean, is this a concern for you yet, or not at all?
It is a concern, particularly because, typically during summer months here in Maine, we are very short on hospital beds. As most people are quite aware, Maine can swell to 10 times its population in the summer months as our visitors come in to enjoy our great weather and our wonderful scenery and stuff. And so our hospitals are often full. And so when you add to that patients who normally would not be admitted because they have COVID, that's just one more thing. And then COVID patients in the intensive care unit require a lot of resources and staffing, so that even makes it that much harder. So yeah, it's a concern for us. And it's one that we don't want to see those numbers go back up again. I think the last time we talked about readiness, preparedness. So Northern Light Health will pull out all the plans that we used the first time that we had a surge. But we prefer not to do that. We'd like to keep those on the shelf, and the single best way that can happen is to not have people get sick. And we know that people who are vaccinated are far less likely to need hospitalization or die from COVID-19. And so again, if you're eligible for the vaccine and you have not yet been vaccinated, now is the time to get it done before we start seeing our numbers go up like we're seeing in the rest of the country.
Yeah. I think you and I, when we had spoken, I want to say that was in relation to, was it hospital workers being required to get a vaccine? Was that what we were?
Yeah, I don't think you and I spoke about that because that
okay.
announcement came out after I was on vacation.
Oh, okay, gotcha. I will say, I did want to ask you about masks because there are some of the biggest school districts in the state are reinforcing mask mandates in the buildings for teachers, staff, students, so on and so forth, on transportation systems. And I think there's sort of a renewed focus on wearing masks after we've had this period of time where people have been in certain situations, if they've been fully vaccinated, allowed not to wear them. Is there something you point to when you speak to the general public or your patients about which type of mask they should wear, which one would be optimal for them to protect them from spread of COVID-19?
That's a great question, and not one that I've really focused too much on. I will say that, if somebody can get either an N95 or a KN95 mask, and we know that those afford a better protection as long as they're fitted properly. And I think that's what I've seen the most, is that they're a little bit more cumbersome to wear than some of the other masks that you have, and therefore can leave gaps around the side that can, make it so that they're not as effective as they should be. But I have not been, specifically telling people to get those particular masks or the surgical mask that you may, or a procedural mask that you may get when you go and visit your doctor's office or a hospital. Cloth masks are still effective. And so I think, at this point, I'd rather see people wearing something as a face covering, particularly when they're going to be in close quarters with somebody else. That's why schools, particularly in areas as the CDC has recommended, that if it's in a higher substantial prevalence of disease, that masks should be worn by children in schools and others in other enclosed areas. So I think, as long as we can get them to mask in some way or fashion, that will help. We know that helped last year for us, keeping our numbers down. And so, I've been recommending that my patients who may be immunocompromised, that they should continue to wear masks when they go indoors. So.
And just a quick point of clarification, right? Masks are just as good against the Delta variant, right? As I know the Delta variant comes with a higher viral load. Does the mask matter, what you wear?
Not really, because really, and we've heard people talk about that, that the viral particles could pass through. But remember, when we cough, sneeze, talk, sing, yell, it's the moisture, those water-laden particles that come out, those droplets that we're trying to prevent the spread of. It's not the virus itself. So we're stopping that droplet. So any kind of barrier. We just know that a 2-layered cloth mask is better than a single-layered mask, and we know, again, going up, a procedural or surgical mask is better than that. And then, of course, the N95 or KN95 are more superior to those. They just block more of that droplet that comes out when we cough, sneeze, talk, yell, sing. And so that's really what the mask is doing. It's preventing that barrier. And then, of course, the same thing happens with somebody who coughs and sneezes at you. If you have that barrier, it's not going to get through. I just caution people, if you've been around other individuals and you're using a cloth mask, make sure that you take that cloth mask off when you get home, wash it, and have another one. And of course, if you're using disposable masks, dispose of them and get a new one.
And just on the Delta variant, do you think that is what's are you attributing the Delta variant to the rise in cases that you've seen of inpatients in the hospitals?
Yeah, I think the data is pretty clear on that now. We are seeing more cases, and as the state continues to do its random sampling on positive cases, we are seeing that the rate of, or the amount of Delta variant here in the state of Maine is starting to get to the levels that we've seen in other parts of the country. It just makes sense. We do know there was a couple of other issues there. If we look at, July 4th weekend, it was not a great weekend to be outside, so a lot of people did have their parties inside. And so that probably played a little bit of a role, but mostly this is the Delta variant and the fact that it just spreads from one person to another person so much more easily because it makes that many more copies. It can make up to 1,000 times more copies than that original strain. So, we make 1 million copies, and now you're talking about 1 billion copies. And so those are the numbers that you're talking about, and that just makes it that much more easily to transmit from one person to another.
My last question for you, because it is 3 o'clock, and I want to be respectful of your time, because you had talked about the state's random sampling. One of the things that the state lists on its report, in addition to the number of cases of each variant, there's a section called caveats and concerns, and they've talked about, the state CDC has said, we do sample more percentage of samples than other states do. I think Maine does about 5.6% compared to 5%, I think, is the average, or what the US CDC requires. But one of the concerns is that there's maybe not enough sampling to give us a picture of what's happening right now. And actually, is that a function of the processing of the samples, or what do you think?
It's a number of factors. So one, genomic testing, or finding out the genome of the virus, is expensive. So there's a cost there. And so, we know that already healthcare is a burden on many individuals. Don't want to add to the cost of that. And two, it comes to the practicality of what are you going to do clinically with that information. And in most circumstances, we are treating individuals who have the Delta variant the same way that we treated those with the Alpha variant or the original strain. The clinical scenario is the same. Sometimes we do want to know what that variant is, so we can ask for variant testing to be done. But really, when the state's doing this surveillance testing, it's really kind of just judging where we are, and then of course to see whether or not there's a new variant that has come out in the meantime. And we do know that Epsilon and Lambda are out there. They may or may not be causing worse disease than we've seen with other things. A little too early to tell on that, but it's a good method for us to just be able to know if there's some other strain out there, and then also to see once again that the Delta variant became the dominant strain after the Alpha variant had become the dominant strain. What we don't want to see is that a new dominant strain that's even worse than Delta shows up. And again, best way for that to happen, to prevent that from happening, is for as many of us that are eligible to get vaccinated as possible. Anytime somebody gets infected with the disease, there's always a chance a mutation occurs and we have a brand new variant. And if that variant's worse than what we see now, then we just have that much more to deal with.
Okay. Dr. Jarvis, I don't want to take up too much more of your time because it is 3:02. Is there anything that we didn't talk about as far as the Delta variant is concerned that you wanted to make sure we get across today?
I don't think so. I do want to just remind people that there are other respiratory illnesses out there now. It is high allergy season, and it's very difficult for us to determine one from the other. The single best way for you to know whether it's COVID-19 or not is to get tested. So if you have symptoms, please get tested.